Recognizing stroke warning signs and prevention. Did you know that your body sends out signals a month or just a few days before you have a stroke? Strokes are definitely one of the most common causes of death in the world. The most odd thing about a stroke is that even though the symptoms usually occur quickly, it can take a person several hours or even days to realize that something is wrong. A stroke is a medical emergency because the blood that your heart is pumping is not reaching a part of your brain. That area of the brain will not be receiving enough oxygen and nutrients, which will cause thousands of neurons to die every second. For whatever reason, cardiovascular problems are growing more widespread over the world, especially among young people. You should constantly pay heed to some cautions, no matter how insignificant they may seem. Many of the indications that occur a month before are not easy to notice, and a lot of individuals either ignore them or confuse them with something else. The most important thing is that you can recognize them. If you see any of the signs that will be shown in this video, you should get to a doctor right soon, since they could mean that you are at risk of having a stroke. Today, you will learn about the 7 signs that your body reveals a month before a stroke, as well as how to prevent this condition and remove this horrible statistic. The first sign is that the pressure is persistently high. If your blood pressure is not kept under control, your risk of having a stroke can increase considerably. Blood pressure is the pressure that blood puts on the walls of our arteries. When this pressure is increased, it is known as high blood pressure. This high pressure can harm blood vessels, and over time, it can cause them to become smaller, weaker, and even rupture. If a blood vessel in the brain bursts due to high blood pressure, it might result in a hemorrhagic stroke, which can lead to bleeding. If high blood pressure damages the arteries that provide blood to your brain, it can reduce blood flow and cause a blockage, which can lead to an ischemic stroke. This is why it is so important to identify whether or not you have hypertension, and if you do, to treat it properly. You should change your lifestyle and take your medications as directed in order to control your high blood pressure. This is important because it reduces the risk of having a stroke or other diseases related to the heart. Extreme weariness or excessive fatigue could be a sign that a stroke is about to happen. Remember that there are many different reasons that might lead to feelings of tiredness. Fatigue caused by a stroke is intense and results in persistent tiredness. This may be strange for you, and it is not related to a lack of sleep or exercise, among other things. Excessive tiredness may be caused by changes in the flow of blood to the brain. This could be caused by atherosclerosis, which is a condition that causes arteries to narrow, or by a blood clot that blocks the passage of oxygen. It is a good idea to go to a doctor for a comprehensive checkup if you are feeling more tired than usual. A person who has suffered extreme fatigue may sometimes have a transient ischemic attack, which is sometimes known as a mini-stroke, a signal that there is a temporary problem with the blood supply to the brain. A transient ischemic attack is a transitory condition that can indicate that a stroke is imminent. The symptoms do not cause any long-term damage to the brain, and they typically last for a brief period of time, ranging from a few minutes to a few hours. In most cases, a blood vessel in the brain becomes blocked, but the body is able to discharge the clot within 24 hours, and the patient no longer has symptoms. On the other hand, this is a clear indication that you are on the verge of having a stroke. If you experience a sudden change in your eyesight, it could be an indication that you are having a stroke. Symptoms such as fuzzy vision, double vision, problems with the eyes, and difficulties focusing may also suggest that there has been an impairment to the brain's circulation. When one of the arteries that provide blood to the eye becomes blocked, it can lead to vision loss. There are several reasons why a person might have problems with their vision. However, this does not stop the probe into what is happening. Numbness or weakness in the extremities, especially on one side of the body, is a warning sign that a stroke may be about to happen. This sudden feeling of weakness or numbness usually occurs in one portion of the body, such as the arm or leg, or on one side of the body. It is conceivable for one side of the body to lose its ability to feel things. These symptoms usually last for only a few minutes or hours, but they should not be ignored under any circumstances. Even if they are not strokes, it is crucial to assess any neurological problems. A person who is about to have a stroke may suddenly find it difficult to speak. The individual may have trouble pronouncing words or putting together complete sentences, and their speech may be slurred. A person who has trouble comprehending, creating, or expressing speech has a disorder called aphasia. A sudden headache may occur just before a stroke. It is important to keep in mind that not every headache is caused by a stroke, and not every stroke is preceded by a headache. When a person has an ischemic stroke, blood flow to the brain is stopped, which can induce headaches. These pains are described as being sudden and severe when they occur. A hemorrhagic stroke occurs when there is bleeding in the brain. The bleeding that occurs during this sort of stroke is responsible for the headaches that accompany it, and these headaches are just as intense. Most people think that this type of headache is the most painful kind of headache. A severe headache can be a warning sign that a brain aneurysm is going to break. You should always keep this concern in mind. A person who is about to have a stroke, whether it is hemorrhagic or ischemic, may have a variety of neurological symptoms. Nausea, vomiting, memory problems, and loss of balance are some of the earlier indicators that may occur. In other words, they could arrive a few days or weeks before the brain closes. On the other hand, there are a number of other differential diagnostic difficulties that could potentially result in similar symptoms. People who suffer seizures, hypoglycemia, encephalitis, brain tumors, anxiety attacks, or illnesses in the central nervous system may experience these symptoms. As a result, it is essential to select a doctor who is qualified so that you may receive a comprehensive assessment. You now know that if your blood flow is disturbed, a stroke could be just one step away. Other risk factors that could result in a stroke include drug and alcohol abuse, obesity, a poor diet, depression, anxiety, and not getting enough exercise. All of these disorders can cause specific processes to occur in your body, which can contribute to a stroke. In reality, strokes do not always show any signs before they happen. This is why it is so crucial to avoid this from happening. Make sure to keep your blood pressure in check. Make sure that your blood glucose levels stay within the normal range. Be sure to get in at least 150 minutes of activity each week. Eat foods that are fresh and healthy. Avoid foods that are processed, contain sugar, or have a lot of saturated fat. Make sure that your cholesterol levels are under control. In addition, be careful to keep your checkups with your cardiologist up to date. Doing these actions will help you prevent a stroke from occurring in the future. If you found this video helpful, please remember to like and subscribe to the channel. You may also help others improve their brain health by sharing the video. I will see you next time.